Welcome to the latest edition of Public Health Updates, covering breakthroughs in the past 2 weeks. Brought to you by LucidQuest. A BMJ open audit of 5 AI chatbots using 250 medical prompts found 49.6% problematic responses, including 19.6% highly problematic and 30% somewhat problematic. Grok showed more highly problematic outputs than expected. Performance was best in vaccines and cancer, and weakest in nutrition, stem cells, and athletic performance. Citations were often incomplete or fabricated, and all outputs were at a difficult reading level. MRI study of over 600 osteoarthritis initiative participants found higher ultra-processed food intake, about 41% of energy, was associated with increased thigh muscle fat infiltration, especially adductors. Associations persisted after BMI adjustment and were stronger with central adiposity, but causality cannot be inferred due to cross-sectional design. A New York City trauma study of 914 patients recruited between 2018 and 2023 found micromobility injuries rose from under 10% to over 50% of trauma cases. About 1/3 had brain injury. Over 2/3 were admitted, and 30% required ICU care. Nearly half involved vehicle collisions. Helmet use was under 1/3, and alcohol was present in about 20%. Pedestrians had nearly double the brain injury rate of riders. A fabricated disease experiment using Bicksoni mania showed how false medical claims can spread through AI systems and indexing, later appearing in search results and even a peer-reviewed paper before retraction. A Nature-published trial of 42 patients with OTOF-related congenital deafness showed about 90% improved hearing, with 38 responders and benefits lasting up to 2 years. Viral vector therapy delivered a functional gene to the inner ear. Children responded best, and side effects were mostly mild. A global survey of over 16,000 people across 16 countries found 70% believed at least one of 6 common health myths. Trust in health information is declining, with 51% confidence in finding reliable answers and 46% trust in media. About 35% reported using AI for health decisions. A Lancet rheumatology study found low levels of GLP-1 in synovial fluid, correlating with blood levels and showing no difference between arthritis patients and controls. Findings suggest systemic rather than local origin and support further research into joint effects of GLP-1 therapies. Preclinical studies in rats and zebrafish showed pemafibrate and telmisartan reduced liver fat in metabolic dysfunction-associated steatic liver disease models. Combination therapy was synergistic at lower doses and acted via complementary metabolic pathways. Human trials are needed. Stay ahead in public health research. Like, share, and subscribe for our updates. Visit lqventures.com or email us at info@lqventures.com for expert help.